you all to our I want to welcome you all to our second lecture in our lecture series for Juneteenth. We are going to be talking about Black mental health this evening with Reverend Dr. Orlando Dowdy. And I just want to thank you for your presence. I'm excited to have you here, and I hope that this will be both educational and informative and an experience that you truly enjoy. So, just a little bit of housekeeping before we get started. If you are present and able, we want everyone to put their names on the screen. If you are associated with any form of media, we would also like you to identify that. This evening, our lecture is going to be recorded. We hope to make this available to folks to go back over in case you hear anything really interesting and you want to go back to it. We're also going to make sure that we provide you with any connecting information that you may be interested in, so that if you are looking for mental health services, that you are able to do so after this. So now that I have welcomed you all here, I do want to quickly go over Juneteenth. For those of you who are here, I hope that you know the wonderful history and why we are looking forward to celebrating Juneteenth. So Juneteenth is a day of celebration in the African American community that is representative of freedom. So the Emancipation Proclamation was signed, and even though it was signed, it still took almost over a year for everyone to be able to reap the benefits of that. And we want to honor and pay homage to those who fought for that freedom as well as that celebration. I am very aware that it is something that I'm happy that I can't even imagine that feeling of knowing that you are free from a situation such as slavery. And so we are building these events because we want to highlight not just the trauma associated with slavery, but we want to highlight the joy in the moment of celebration. We want to make sure that our events and everything that we host that is focused on Juneteenth looks at the growth within the Black community. We want to be able to look at how we continue to excel, how we continue to pursue freedom, how we've gone through many different movements, and even now are in a huge transition throughout the country in continuing to advocate for the right to be treated in a humane way, right? Because we're always talking about how can we build a society where, to quote Reverend Dr. Martin Luther King, where it's not the color of your skin, but the content of your character, and make sure that everyone is experiencing a beautiful and healthy lifestyle. So we are here to pay honor to that. We hope that all of our events bring you to a place of better health, better living, and celebrating the accomplishments and the excellence of Black people in America. And that being said, I am now going to introduce the wonderful Reverend Dr. Orlando Dowdy. He is an experienced pastor and psychotherapist with a demonstrated history of working in the religious institutions industry. He is skilled in nonprofit organizations, pastoral care, counseling, conflict resolution, teaching, and workshop presentations. Strong healthcare services professional with a doctorate in divinity and ministry focused in pastoral counseling. He has 5+ years experience with Duke and the AME Zion Heal Partnership, working to minimize health disparities, inequities, and more involvement in clinical research. He has a Master of Divinity from Duke Divinity School and a doctorate in psychotherapy from Graduate Theological Foundation. And he is a 20-year military veteran and former law enforcement officer. So Dr. Dowdy is here with a wealth of knowledge and experience. We're very excited to have him. We hope that you will enjoy this evening, and please feel free to use the chat if you have questions. If you need any help with Zoom at any point in time that you can't hear or something happens, please feel free to let us know. And thank you again for your presence. Dr. Dowdy, I'm going to hand it over to you.
Thank you so much. Good to be here. And I appreciate the opportunity to share. Some of you I know and some of you I may not know. But with that being said, I'll talk about first what got me into this. And she just told you a little bit about my background, but particularly when I was in law enforcement, I found myself taking a lot of, and I had just entered ministry, by the way. Hadn't gone off to school or anything, wasn't pastoring, but I just started ministry. And I was taking a lot of African-American young males to jail in my police car. And I didn't realize until after I left the department, after I had resigned and entered ministry in a more full-time capacity, that one of the things that I was doing was ministering to these young people. And it broke my heart because some of them, it was just a case of recidivism where, it was a revolving door. I picked them up one day and, sometime later, I'll be picking them up again, taking them to jail. But I was trying to help them the best I could. And then some of them were killed. Some of them died in the business that they were in. And I found it very unfortunate. And then as I entered ministry, I got more into helping people religiously with their spiritual lives. I kind of gravitate, I think it was a natural gravitation towards counseling. I took some counseling courses at Duke and I said, I like this. And so it enables me to help people in a more in-depth way, to be able to go deeper with them without any law enforcement involvement, unless there's a legal liability that I have to meet, unless that occurs, but that does not occur. I'm able to do that. So it's sort of a natural progression for me. And so I have some information I want to share with you. One of the first things I'm going to do is share a video. I've got several videos. Most of them are very short. This is the longest one, about 13 minutes. So if you will listen to the videos, if you have any questions, you can put them in the chat. And then after I finish my presentation, then we'll be open to some questions. I don't mind if you ask me questions during the process, during the presentation, unless the organizers would prefer that you ask questions at the end. All right, so let's do this. Share my screen here. There we are.
When you look at me, what do you see? Now, I'm gonna go through some of the things that I typically hear. To the very astute, I usually get I'm black, I'm bearded, and I'm strong. I also get I look like NBA superstar James Harden. I'm most definitely the poorer version. I get hip hop superstar, Emmy Award winner, Donald Glover, AKA Childish Gambino. Yeah, that too, right? And last but not least, I get Curtis Jackson, AKA 50 Cent. Now, one of my goals is definitely to get rich or die trying. I think Sally Mae is putting the emphasis on or die trying, right? But see, what I don't hear is Phil, you look like somebody that lives with depression and anxiety. Phil, you look like somebody that was suicidal for 15 years, every day, 5 to 6 times a day. They don't say, Phil, you look like somebody that was driving on Interstate 95, wanting to crash your car to end your life. No, because see, here in America, when we think about mental health, we think about the homeless man who's walking the streets, talking nonsensically to themselves. We think about the white celebrity who takes their life via suicide. We think about the white mass murderer who goes into a high school and takes the lives of innocent children. Or it's usually your president who loves to tweet venom from the hip. But see, rarely does the conversation speak of a father of 2 kids, someone who possesses a master's in exercise science, a master's in social work, somebody pursuing a doctorate. Rarely is it a person of color. Rarely is it a Black man like myself until now, because Black mental health matters. Now, you may be asking yourself, what is Black mental health and why is it differentiated amongst racial and ethnic lines? Black mental health are the individual and collective experiences that influence the wellness of a community. Trauma is the biggest influencer of Black mental health. We're talking about historical trauma, slavery, Jim Crow, the civil rights movement, the Tuskegee experiment, up until present day trauma, when you see somebody that looks like you get killed in their home. Rest in peace, Botham Jean. When you see somebody who's living with mental wellness issues get killed by the police. Rest in peace, Laquan McDonald of Chicago, Illinois. Or when you see somebody that looks like you get killed by somebody that looks like you. Rest in peace, XXX Tentacion. See, when we talk about trauma, trauma is unique to the individual, and I'm no different. There were 3 impactful traumatic situations that I've experienced in my life outside of the genetic predisposition, because my grandmother lived with schizophrenia. I hearken back to being in 8th grade, 13 years of age, on the way to school. My mother has a nervous breakdown. She's crying. She's pulling at her clothes and her hair. She's cursing. I felt helpless because I couldn't help her, or I couldn't help myself. And see, I was expected to continue to go into school that day and achieve. It's funny, when I first started telling this story, I told my mother, listen, I'm telling the story of when you had a nervous breakdown. And she said, Phil, that didn't happen. Now, I know I'm getting older. I have a few grays, right? But I swear I remember that. And then she called me a week later and she said, Phil, I didn't know you remembered that. As if I wouldn't remember the most traumatic situation that I've experienced in my life. And that typically happens. We're often expected to just continue on because we are so resilient as a people, because we do survive, and we've survived for hundreds of years. And I was expected to survive and go into school that day and perform. And I did, because like many of us, I learned how to suppress my emotions and my feelings. But what if I didn't? What if I went into school and I started arguing with peers and fighting? What if I started arguing with the teachers? What if I did criminalistic behaviors within the community? Would I be deemed incorrigible and unable to be in the school setting, in the community setting? Or would anybody care that I just experienced this traumatic situation that has impacted me? Fast forward to my 12th grade year, 17 years of age, January 2001. My mother said, Phil, come downstairs. She said, Phil, your brother Bobby died. And I started crying. That was probably the only healthy coping skill that I had at the time, right? Because being a product of the hip hop culture, hip hop tells me when somebody dies, you either go out and get some liquor or you go get a rest in peace tattoo. Well, I wasn't old enough to drink. That would happen once I got to college, right? But I went out and I got this rest in peace tattoo. As if that was going to do something, if that was going to take away the pain of losing a primary relationship. It didn't. And people ask me, Phil, well, how did your brother die? Say, the opioid epidemic is popular now. But in the Black community, in the hip hop community, especially amongst Black male, it's always existed. He was one who liked to use codeine and Xanax. I don't know what he was trying to cope with. I will never know. I went to school that Monday because I didn't have anybody to say, Phil, stay home. Because my mother was going through it because she just lost her only child. And I went to school feeling all of this emotion. And I remember it like yesterday. I was sitting in computer class. Miss Williams, my computer teacher, came up to me and I don't know what she said. She said, Phil, she could have said, Phil, what was the score of the Eagles game last night? I let her have it. I blacked on her. I cursed her out. Why? Because I had all this built up anger, all this built up rage. Because see, when we're talking about depression and anxiety for Black men especially, it doesn't look like somebody laying in bed for 6 and 7 days on end. No, it manifests itself through anger and rage. I ended up getting suspended that day. And Ms. Williams and I were able to laugh at the situation years later because I was able to cope with it and understand what I was feeling. But again, it was a moment in time that impacted my life. My third and final story happened at Bloomsburg University in Bloomsburg, Pennsylvania. Again, we remember traumatic situations, and I remember it like it was yesterday. I call it the juice story, right? Because when I go fill out job applications and it says, have you ever been convicted of a crime? As long as it doesn't say misdemeanor or felony, I can ignore it if it says that. But if it says, have you ever been convicted of a crime, I have to check it all. And then I'll put, well, it all started with a cup of juice. And then the employers, they laugh like, oh man. And I laugh like, ha, ha, ha. That's my life. So the juice story is, I was coming from the gym to go get me something to eat. I got my food. I paid for it, emphasis on pay. And you know how you go to McDonald's, they give you a cup and you can go to the fountain and get whatever drink you want. And I did that and I tasted it to see if it was watered down. But see, when you go to a predominantly white institution like Bloomsburg University, it seems like they have all the minorities' names on a list. And the school police officer said, Phil, that's stealing. Mind blown. And me having this anger, this frustration that's built up over years of trauma, and me not being able to express myself in a healthy way, I blacked on her just like I did Miss Williams. Unbeknownst to me, that would lead to 20 plus charges. I ended up going to jail that night. I ended up getting expelled from school. I ended up doing a weekend in jail because listen, they say you'll get judged by a jury of your peers. With the average age in that community being 60 and over, it wasn't going to be a jury of my peers. But I needed that experience. I needed it. And I needed it because it told me that, Phil, I have to do something different. I ended up appealing to get back into Bloomsburg University, and people knew me, so people wanted me back. And so I got back, and I was focused. One day, my psychology professor, Dr. Cambone Camara, God bless the dead, he said, Phil, come talk to me about anything, anytime. And I took him up on that. I went and talked to him, not to talk about school. I went to talk to him about a young lady I had been courting, right? And I wanted to understand, why didn't she want me? So I went to his office. I'm like, listen, I bought her sneakers. I took her to the movies. I took her to dinner. Well, my mom took her to dinner and all those things because I didn't have a job. Thanks, Mom. But he said to me, Phil, in life, you change to get something or to keep something. I'm like, man, what are you talking about? Little did I know that would become my mantra, that I realized I had to change. I had to work on my wellness so I can be whole. It took approximately 10 years, because that's the average length of time that they say somebody who lives with mental wellness issues, that's the time that it takes for them to come to grips with it and to seek treatment. For Black people, I think it's much longer. And so within those 10 years, I've been on medication, which quelled the suicidal ideations. They're no more. I go to therapy every week. Hi, Dr. Val. It's been so critical for me in my wellness because I decided to go from living to thriving. To my Black brothers and sisters, you too deserve to go from living to thriving. We no longer have to wear the mask. We're survivors. There's help now. We can get help and walk out there with our heads held high and get the treatment that we need so we can go from living to thriving. To my non-Black brothers and sisters, will you now view the Black person that you come in contact with and might be in a negative way? And recognize that, you know what, they might have gone through something. Or to see them when they excel, what they had to go through to get to that point. Or will mental health continue to be viewed in America as Kate Spade, as Anthony Bourdain, as Chester Bennington, as Robin Williams? Would it now include actors Sam Sarpong, Lee Thompson Young? Will it now include 10-year-old Ashanti Davis, who took her life because of bullying? Will it now represent Emmanuel Sloan, who's the reason why I'm here? Because at 19 years of age, he decided to take his life by jumping in front of a train. This isn't an indictment on you or on America. This is just a public service announcement that's stating that we're here and we deserve to live and to thrive. Thank you.
Okay. As you can see, that's one person's journey with mental health. He's very passionate and very moving, but that says something about all of us, because most people struggle with something. If it's not mental health, it's physical issues, it's relationships, but we struggle with something. And later on at the end, when we start with the questions, if you have anything about that you want to say, please say it. Now I want to talk to you a little bit about some mental illness and what others have gone through and what you can expect and what you can look for. Let me pull it up here. There we are. Share my screen again. All right. All right. So let's talk mental health. Mental health includes your emotional, psychological, and social well-being. A lot of people don't understand the social well-being. There's a nerve that runs through your body from the stem of your brain all the way down to your colon. It goes out to your ears and some other parts, and it's called the vagus nerve. And we all have something also that's known as the sympathetic nervous system and the parasympathetic. Sympathetic nervous system is simply this. You've heard whenever you encounter something that startles you or frightens you, the fight, flight, or freeze syndrome. That's the sympathetic nervous system. The parasympathetic nervous system is one that causes people to just kind of, they don't freeze, but they disassociate, or they're just there. And you can see it emotionally. Sometimes I can see it in the sessions. And we call that the dorsal vagal syndrome. But one thing that helps with that is with the dorsal vagal, the social well-being. That's the part that the polyvagal theory system talks about, is being social. That's one of the remedies for depression, because people tend to withdraw, so being social. We have to understand that we are social beings. We were not designed by God to be hermits. As a matter of fact, with the story in Genesis of Adam and Eve in Genesis 1 and 2, we understand that God said, here Adam is, I'm looking at Adam, but I think he needs someone, he needs a companion. And so God created Eve. And most of us can be privy to mental health by heredity or genes, genetics, biological factors, life experiences, family history. If you have a family history of mental health, let that be your cue to be aware, really to be aware. Because it could be a key to either you or your children or your grandchildren, because there's a well-known research fact that once it occurs in your family, it has the propensity to go further down the genetic tree. I want to talk about some myths and some facts. You ever heard anybody say, mental health problems don't affect me? I'm good. And we're going to talk about the church, and we're going to talk about society and the Black community as well, African-American community. But mental health problems don't affect me. But in actuality, mental health problems are very common, very common. Stressors can get you stressed out. And once those stressors become chronic, unless you do something to alleviate those stressors, then we can see they can lead to the development of diseases, hypertension, diabetes, strokes, heart attacks, you name it. They can lead to mental health issues. 1 in 5 American adults experience a mental health issue. 1 in 5, that's pretty high. And suicide, according to mentalhealth.gov, is the 10th leading cause of death in the United States. And you heard the first speaker talk about suicide, people that he became aware of that had committed suicide. Now, this next myth is a big myth. Some people don't think children can experience mental health problems. I think what the issue may be is that we don't want to believe or accept that children can have mental health problems. We like to believe that, they're pure and pristine, and that unless there's some biological malady with them, that they're okay. But even young children can show early signs of mental health concerns. Schizophrenia is known to develop in teenagers. And so you just have to be able to look at the signs. And I'm almost positive that those of you who are on have been experiencing or have had an experience with someone who had a mental health issue, but maybe you just weren't aware of the signs, or you ignored the signs that were there. Half of all mental health, so I'm going to highlight that, yeah. Mental health disorders show first signs before a person turns 14 years of age. Yeah, I've experienced that in my family. Yep. And 3/4 of mental health disorders begin before age 24. Particularly if there's something biological, there's something neurobiological, something going on in the brain. There's some type of disorder, whether it's chemistry, and lots of times medication can help provide a remedy. I'm not going to say correct or cure, because they're treating the symptoms, but also treating selected serotonin reuptake inhibitors, SSRIs, that are typically prescribed for just one type of medication is prescribed for depression. They help the brain, the neurotransmitters, receive more serotonin, whereas there's a chemical change where the serotonin is not being received, if I'm saying that correctly. And the unfortunate piece is less than 20% of children and adolescents receive the treatment they need. Less than 20%. It goes ignored, but we hope it's not mental health. And these are common illnesses. And just like diseases, they affect persons of faith just like they affect everyone else. Because you are a believer, I know that there is, and theologically, I may be stepping across the boundaries for some people in their theological beliefs. There are some who believe that because they are people of faith, that they won't get sick. Not that they shouldn't get sick, but that they won't get sick. I'm not going to really deal with that. I'm just going to talk about, most of us know, including ourselves, people of faith who have common illnesses like anxiety. Anxieties are the most common mental illness in the United States, affecting 40 million adults. Anxiety. Whether you get treatment for it or not, when you're driving down the road, and here you are speeding in the city, Come on, you're in the city, right? Stoplights everywhere. So you're speeding, you're flying by people. I'm gonna be late, I'm gonna be late. Skirt, you're stopping. Why? Stoplight. So all those people you sped past trying to get ahead, they're either beside you or right behind you because of stoplights. And really, how much time do you save by responding like that versus taking another approach, a better coping mechanism? One is just to deal with it. If I'm 2, 3, 4, 5 minutes late, then I'm late and I deal with the consequences. Because driving like that, you may save a minute or two, depending upon how you're driving. But a lot of us deal with anxiety. Some people have testing anxiety. Some people have anxiety with relationships. You're in that home, and all of a sudden you hear someone come through the door, or you hear the car in the driveway. Anxiety or stressors. Or on the opposite end of that spectrum, you're driving home and you hate to have to go into the house. Or you prevent yourself. You find some things to do so that you can go home late, hoping that a certain person is asleep. Anxieties and stressors. 40%, 40 million adults in the United States. And we have out of that general anxiety disorder, generalized anxiety disorder, typically called GAD, about 6.8 million. Anxiety, these are some of the breakdowns of anxiety, what you're seeing. Then you have panic disorder, where panic disorder can be very disorienting. I had someone call me an emergency. I knew it was outside of the normal session time, but she was in a parking lot. It was at night. She was having a panic attack in the parking lot. And she had a paper bag and she put it over her head. And I was able to talk to her to use some coping skills to help her to calm down, where she would be able to get back into her vehicle. So panic disorder can be very disorienting. PTSD, and contrary to popular belief, you don't have to be in combat to experience PTSD. Any trauma, any form of trauma from childhood until the day you die can cause you to suffer from PTSD. It's called post-traumatic. It's after trauma. And we see here that women are more likely to be affected with PTSD, anxiety than men. Rape is the most likely trigger of PTSD. 65% of men who are raped, and men are raped. Think about anyone being raped. It's how you feel about it. It's the shame or embarrassment or thinking I could have prevented it. Or if you're a child, you're threatened, you can't tell anyone. I see where there was a young lady who, I just saw the video where her pastor, when she was 16, and she's married now, she came out on a pastor because the pastor didn't tell the complete truth about how since she was 16, he was having sex with her. 45.9% of women who are raped will develop this disorder. And childhood sexual abuse is a strong predictor of lifetime likelihood for developing PTSD. There are things that we carry that we do not talk about. We try not to think about. And sometimes we repress those things that happen to us. I've had a number of men who were violated sexually by other men that come into my practice. And sometimes I'm the first person they tell about it, they talk to about it. But they recognize it's something that they have to work through. You have to work through it. If you don't work through these issues, then more than likely, you will have problems with them the rest of your life. They will manifest themselves symptomatically in some way. Depression is a mood disorder. It causes a persistent feeling of sadness and loss of interest. You may feel fatigued or tired, do a lot of sleeping, sleep in a fetal position, lose interest in the things that you normally would do socially, withdrawal, become a loner. And then there's what we call suicidal ideation, where you're thinking about suicide. There's one thing to think and say to yourself, I don't feel like being here. And it's another when you start to plan, when you start to develop a plan and you have the ability and the means to carry it through. A plan is not any good if you can't carry it through. But if you have that ability to do it, then that's something else that becomes very dangerous. And depression may require long-term treatment. I've known people have had depression. I'm talking about it goes from like mild to moderate to severe. In the moderate to severe category for years who struggle. There's something that's called treatment-resistant depression that for most treatments, you have the psychotherapy part or the talking called talk therapy also. Then you have the medication piece. They've gone through just about every medication that is known, and it doesn't seem to be working. Well, they have some other treatments available now, and one of them is an old drug, and that they found that is really helpful with depression. It's called ketamine. They even have a nasal inhaler now. You can get injections depending on what type of treatment you get or the vehicle for administering it. I was at Yale, and I was talking to a psychiatrist who was the principal investigator, the researcher involved with ketamine, a newer use for ketamine, and had a nice conversation with him, except, with clinical trials, particularly this one, you had to be on site for it. But they also have some other treatments available. So don't be discouraged if you're one of those persons that suffer from depression and you haven't been able to find relief. We also have dysthymia, where you have depressed mood for at least 2 years. Excuse me. You may have periods of major depression along with periods of less severe symptoms. Postpartum, it's a real thing. For all the men, it's a real thing. My daughter, to her first child, I don't remember if it's the first or second child, excuse me, but she went through postpartum depression, something that happens as chemical changes, hormonal changes when a woman gives birth, and it's a real thing. And some women who are listening may chime in on this when we get to the question period. Psychotic depression, where you start having hallucinations or delusions. Hallucinations involve our senses. You're hearing things, you're seeing things, or you feel like, something's touching you. Delusions are those things that like a stretch of reality, like it's a far stretch. Like, yeah, you can drive a car, but when you say that you were at NASCAR driving a car, then that's a delusion. Seasonal affective disorder, guess what? Some people may go through it and not realize what's happening. Usually seasonal affective disorder, that's what's called seasonal, is in a particular season. It's very common in winter. Think about it. The sun is not out as long, the nights are longer, it's cold, you're cramped up inside. A lot of people in Alaska and in those colder climates, and when you have the nights, we have those periods in certain parts of Alaska where the nights are continuous for periods of time, they go through seasonal affective disorder. It's depression, but it's typically only for a particular period. Bipolar used to be called manic depressive, where you have highs and lows, and it may vary from hours to days. It just varies. Well, you know what? If you were to Google how many athletes or celebrities have bipolar, you might be very surprised. Usually when they in the manic stage, they don't require a lot of sleep, may be very creative or talkative. But when they get into the depressive stage, the low part of being bipolar, then it's more like depression. Let's see. These are just some symptoms: angry outbursts, irritability, crying over small matters. Someone who cries frequently, and we can see this often when a death has occurred, when someone has passed on to their eternal reward, which is natural. Grief and bereavement, that's natural. But when it becomes sustained for periods of like maybe 6 months or longer, then it may be a problem and it may need to get professional help. So these are just some of the symptoms I'm going to go by. There are some differences for children, though. They can be the same, but they can be different. In younger children, I like these here. Symptoms of depression may include sadness, irritability, clinginess, worry, aches. My stomach aches. Oh, my head hurts. Don't want to go to school. Or being underweight because they're not eating. In teens, some of the same feelings, but to include, feeling negative and worthless, low self-esteem, poor performance, poor attendance in school, feeling misunderstood, eating, those are the types. You have to be alert. You have to, when someone is not acting their usual self, that may be a sign that something is going on. When to see a doctor, of course. I think you need to have a mental health checkup. A lot of times your primary care physician will do screenings. I know one I had before he left the practice. He would just do a PHQ-9, something I do here in the office, which is the Patient Health Questionnaire 9. And the number 9 is simply because there are 9 questions. I will look at his computer, I'll look over, I said, okay, he's going through the depression screening. They usually try to screen for your mental health by some of the questions they ask. But if you feel like, of course, if you're just not yourself, certainly go to a doctor. And if you have a spiritual crisis, usually most therapists today deal in some type of spirituality. I mean, they're trained, they may not have the theological background that I have, but usually try to help you spiritually at their level. Whoops, didn't mean to do that. Talked about biological differences in brain chemistry and hormones. Risk factors, I mentioned depression occurring in the teens, 20s, or 30s, but it can happen at any age. Let me go over some of these. Triggering depression. Certain personality traits. We talked about trauma. We talked about relatives. But this category here is a big category. People in the LGBTIQ community, or if a person has variations in the development of the genital organs, this is one that comes across with people that I see from that community because of a lot of issues. The stigma of being gay or being queer or being polyamorous is those people who believe in loving. It's not just sex, but loving more than one person. And usually it's around 3 people. Sometimes it could be more. But from their, and then some of the threats and the fear that they have, more so in the past, it still exists. And someone from that community will really be better qualified to speak to that than I am. But, going to bars and other places. but that's a big one for them. I talked about history of mental health disorders. And then we get to the church. Ain't nothing wrong with you. You just got the devil in you. The devil. As a Christian minister, I believe the devil exists. Jesus taught us that. It's in the Bible. But everything that we go through, you can't blame on the devil. Some of you may be old enough to remember Flip Wilson, and Flip Wilson will talk about how the devil made me do it. The devil had nothing to do with you ordering that pizza and eating almost the entire pizza by yourself. The devil had nothing to do with that. The devil didn't have anything to do with you eating 3 or 4 slices of cake at one time. That was you. The Catholic Church, when you look at their book of exorcism, they have methods of distinguishing what is demonic possession and what is not. And they do it by elimination. They, first is a door swinging. They don't say that's a ghost. They're calling a carpenter. Is the planing right? Does the door need to be adjusted? There's knocking in the plumbing. Well, they don't say that's a ghost. They say, well, let's call in a plumber. And after everything else has been eliminated, then they may say that we actually have a possession. And so I said all that because we need to take some practical steps in what God gave us. When it says that we are created in God's image, he doesn't have a physical image. But let's look at his character. He is a creator. He has given us. We're created in his image. We are created. I'll say it. We're created to create like he does. Engineers, building bridges, building roads, medicine, drugs, you name it, carpenters, brick masons, bakers. Creativity is one part of his character. Just Psalm 139, if you take a look at that. And this data was obtained from the mentalhealth.gov, mayoclinic.org, and the National Institute of Mental Health. So I want to share let me stop here for a minute. I want to share this video clip is on like 1 minute and 33 seconds. So it is not long at all, but she's getting ready to speak to something that we all who are people of faith, particularly in the African-American community.
Ready to start eating healthier? Meet Kachava. Kachava is the world.
Got to get through some
Those
of these
are words.
ads. All right, let me share. Another TED Talk. You might say I like TED Talks.
What goes on in this house stays in this house. I don't talk about my feelings to other people. Girl, that's for white folks. Black folks, we got this. I'ma just go to Jesus and pray about it. I'm not weak. I'm not crazy. These are some of the common things I hear when I tell people what I do for a living. See, I'm a mental health therapist. Oh God, y'all, I said that word, mental health. We don't talk about mental health in the Black community. And that keeps a lot of people suffering in silence. So yes, as a mental health therapist, I listen to people talk all day. So first, let's explain what does mental health mean. Truthfully, it's the overall well-being of your mind. The issue we really have is about this word called mental illness. See, mental illness is just something that affects the way you act, the way you think, or you behave. And we all know there's times we act differently, we behave differently, and we feel differently. That's what mental health is. So as a mental health therapist, y'all, I sit and I talk about mental health disorders.
All right. She pretty much summarizes what mental health is. And I would suspect that by this time you all have some questions or concerns. And I'm about halfway finished here. So the thing is though, is that in the church, in some churches, some faith traditions, mental health has been vilified. We said, just pray. There's nothing wrong with prayer. There's power in prayer. But when you look at people that have physiological issues, common ones like diabetes, high blood pressure, maybe some heart problem, and one big one, cancer. And even with COVID-19, guess what? We went to the doctor. We go to the doctor, but it doesn't keep us from praying. We pray hard. We walk by faith, may not even claim it, but we're still praying. We're putting our faith with our works. Yet when it comes to mental health, the tradition has been in the African-American community, just pray it away. Okay. Then why don't we do that with the physical ailments? Again, we're created in God's image. And I believe that in that image, he gives us the ability to do certain things. And one is to be able to help one another. And so let me just share this one, this screen here. All right. This is from NAMI, the National Alliance on Mental Health. It's an article by Alicia Montgomery. Two things I highlighted here I want us to pay attention to. One of the oldest and at times only emotional outlet and support for Black women has been the church. According to the Pew Research Center, 91% of Black Americans say religion is somewhat or very important in their lives, and 79% identify as a Christian. So in this, she's telling her story. And as she tells her story, she talked about her suicidal thoughts, that even though she was in the choir, she was singing, those suicidal thoughts did not go away. She had a suicide attempt at age 14. And because of that, she felt like she could never go to church again. And her experience was she committed the greatest of sins by trying to take a life that she did not create and to take it away from this earth. But what I like here is we don't need silence, my sisters and brothers, regardless of your ethnicity. We're all human beings. We don't need silence. We need help. We need help and to help one another. And I mentioned that it's been called something that's demonic or a vice of the devil, mental health issues, but we need to get beyond that. It's time that we understand that the church should be a place of healing. Church is a hospital, should be. Should be analogous to a hospital, a place where hurting people come, people who are sick, to be healed. How Black churches can do better. Well, let's look at a few items here. Let's change the conversation. Number one, change the conversation. And I mentioned that mental health issues are just as common as physical ones, and they shouldn't be demonized. And if you're struggling with your mental health, it does not mean you don't have faith. I've had migraine headaches ever since I was a teenager. I mean, they ran all kinds of tests on me. Even ran these rods, they seemed like this long. Both my nostrils had a little S shape in the center to get to the base of my brain. And here I am like 16 years of age. Well, for me, it's like the Apostle Paul said, he had a thorn in his side. Well, he had a thorn he couldn't get rid of. It's, my migraines are treated and I have medication that helps prevent them, but it does not daunt my faith. I still believe. And that should be what we should do with one another, is to support and uplift each other in accordance with our faith, not against the faith. This is like some people have science and faith as two so totally different things. I think that they merge, they complement one another. That's another conversation for a completely different time. I'm almost done here with my presentation. Now I want to take you to this last video. Then we'll talk about what we can do for ourselves and for others. Then we'll have some questions. All right, back to videos. And share screen to share. All right.
To go through life and some of the stressors that you may experience as a Black person in America, you have to show a certain amount of strength. In the Black community, we reward strength, and then we have this limited view of what that means. Therapy is a strength. Crying and releasing it is a strength, because it's much easier to say, I don't want to deal with that. When you have to deal with the thing you want to avoid, that's strength. I'm at a point now where my mental health is not negotiable. I wasn't always taught to check in with yourself, see how you're feeling. What happens is that either you're going to learn healthy ways of coping, or it may be unhealthy ways. I grew up in Richmond, Virginia with my mom. I'm her only child, her best daughter. My father, we have a relationship, but most of my relationship throughout childhood was seeing him in a prison. In my neighborhood, in my family, I always knew I was going to college. Even as a first generation college student, you take on that pressure, I have to do this. People have expectations of me. And then when you're starting to feel that separation between how people see me and what they want me to do, but I need help. I just started saying, maybe 2 years ago, don't call me a strong Black woman. Because I don't have to buy into that. But if you label me as that, you're not going to see me as a human. I felt the need to form Black Mental Wellness because there was a huge piece of mental health missing, and that was the mental health of Black people in America. So when you think about psychology, you think about the theories, you think about the approaches to therapy, it's all based on white people. What we know to be true is that Black people communicate differently. We have different stressors. And I think it's important to know this because trauma encodes itself in your body. And that stuff is passed down. The stressors and triggers that are unique to Black people in America is our whole existence in America, right? How do you show up? How is your hair? How are you dressed? That's so much stress, and that's not even the job. So when we think about the cultural shifts and changes, the last 2 years or so, it just seems like it's now the in thing to talk about mental health, and it's the in thing to talk about Black mental health. I feel like educated Black people, they like to say oh, my therapist said. Every time you say that, you're normalizing that experience for someone else. All of those things breaks down the stigma and opens it up for people. Actionable steps that I share, I like to think about the start of the day. Can you wake up, even if it's 10 minutes earlier, where you can just have that quiet time to yourself? Another actionable step, find at least 5 minutes, go outside and get some fresh air. Because we're spending so much time in our homes or in these enclosed spaces. So many people think that therapy and mental health is for people who are sick. And I want them to know that mental health and therapy is for everyone. There is a space for Black people as it pertains to therapy, and that there's something that we all can gain from being a part of it.
All right. Okay. So that's a perspective from the clinical psychologist and her. Um, I see a good question there. I'm almost at the question phase. But yeah, that was from her experience and also her training, what she believes should happen with mental health, particularly with Black people. I want to help us now to take charge of our mental health. So I want to share some information that should be helpful to you as you engage in mental health, as you talk to providers, and as you talk to family members, and as you talk to God. So, all right. Well, find the right specialist. That's number one. You can ask your primary care physician or nurse to help you. They may have someone, they may have some ideas or thoughts. For instance, if you have marital problems or your couple and you're having some issues, then certainly you want to see someone who was trained in that and that those particular theories. No couples of marriage. You wouldn't want someone that only sees children to be your couples therapist. As a matter of fact, they wouldn't do it. But find the right person. And I will say this, particularly now, there may be a long wait. Sometimes people tell me that they've been told that the wait list is like maybe a month, maybe 2 months. If you get a wait list of 2 weeks, you're good. You're good. There's just a lot of people that need mental health services, and we don't have enough providers. Also, the third one, if the first mental health specialist you see isn't a good fit, keep looking for the one who works for you. That's something you hear in mental health. You don't hear that so much with medical doctors about a good fit, but you are going to tell this therapist, hopefully, that your innermost truths, your innermost secrets, because therapy can only be as good as much as you're willing to speak about what's going on with you. If you withhold, then that's going to limit the therapist and how he or she can help you. And sometimes the person may not be the right fit for you. There's some things called transference, countertransference, and projection in therapy. Transference happens with someone who's seeing a therapist. If someone reminds you of an abuser, a person probably may not be the best person for you to see, because every time you see that person, you may see your abuser. So that's just some helpful tips. And you heard me talk about socialization in the beginning. Surround yourself with family and friends, and continue doing what you love. People who suffer from depression stop doing what they love. Stop reading, the sports, writing, all of that. Next thing is important. Make your first appointment. Make it. And keep it. If you're going to make it, keep it. And be ready to talk about your health history. Just like, you go to see any other medical doctor, any other specialist, your history is going to be important. What's going on with your family? So it may be a little lengthy, but it's a one-time deal. So like I said, the questionnaire may be lengthy, but complete as much of it as you can and be clear about what you want and your need to get better. You have to be able to articulate what your goals are for therapy. What do you want to have happen? We want to communicate better. Okay, all right, that's good. Communicate better. Explain treatment options from your mental health specialist. Ask that person to explain, what is it that you do? What makes you special? What makes you different? What makes you similar? And please do not be afraid to ask questions. I know there are some people who do not hesitate asking questions. If you have any thoughts about what scares you, for instance, there are some people who cannot tolerate being enclosed, like doing an MRI. In the normal MRI, where they slide you into the little round chamber. And so they have developed other MRIs where you're not enclosed. Will I have to take medication? Unless the therapist is a medical doctor, like psychiatrist, they may give you their thoughts about it, but they cannot evaluate you. Only a medical person can evaluate you for medication and prescribe it. And so talking about medications, you're talking about a psychiatrist or medical doctor when you start talking about that and what are the side effects. How often should we meet? Are we going to meet once a week? We're going to meet twice a week, once every 2 weeks, once every 3 weeks. How often are we going to meet? How long will it take for me to get better? Now, if someone tells you a certain time, you might want to get a second opinion. Most of us don't know how long it would take because a lot of variables come into play. Do you keep your appointments? Are you on time? What I mean by on time, if you have a 60-minute appointment or 50-minute appointment, are you coming in 20 minutes late? It's shortening your time. Many variables. Are you, some therapists prescribe homework. Lots of marriage and family therapists will prescribe homework. Are you doing it? If you're doing dialectical behavior therapy, which people who have borderline personality disorder, that's good treatment for them, but it requires notebooks and things. Are you doing the work that's required? And then if there are any biological factors or medical factors that come into play, is the medicine working? Is it not working? And stay involved. Some ideas here: keep a wellness log and monitor your progress. And if your treatment plan is not working, talk about it. Say, maybe we need to change it. What are your thoughts? Stick with it. Most therapies and medications take time. One of the things I have discovered in the Black community is that some people who are new to therapy, they think they're going to be better after 2 or 3 times. I'm sorry, boo. It doesn't work that way. It's like peeling an onion. You do it one layer at a time. If you put on 100 pounds and it took you a year and a half to put on that 100 pounds, guess what? You're not going to take that 100 pounds off overnight. No. It's going to take you just as long, if not longer, to unpack that, to take that weight off. And so if you come in with 30 years of trauma, don't expect, unless God does a miracle, and unless that happens, please don't expect it to be done in 2 to 3 sessions. And your treatment plan may change based upon your changes and what the therapist sees. And remember that you have control over living well. You have control over living well. So get through it. Be realistic. And this is my presentation. And now I am ready for any questions or comments. Let's see. Okay, I see was someone going to say something? Because I'm looking at the chat right now and I see where someone has asked or made a statement that the stigma is the reason why so many of our children are self-medicating. Yeah. Marijuana is a big one right now, but also opiates, pills. There's meth that's out there. Yeah. Good question. What is the difference between having a bad day or bad week and having a mental health breakdown? Shucks, I have bad days. I mean, you just feel, you may feel rotten, you may feel discouraged, but you go home, you go to bed, next day you feel better, you're back to your normal self. or even a bad week. I've had what I thought were bad weeks. And well, I said, man, glad when Sunday comes, go to church, worship. I believe Sunday's the first day of the week, not necessarily the work week, but I'm like, okay, I'm looking for next week to be better. You're able to rebound, you're able to recover. Where in a mental health breakdown, there is no recovery without help. Having a bad day or having a bad week, you don't necessarily need any help. You may want to talk to someone, but you don't need help from a professional. Mental health breakdown, you need professional help. So therein lies the difference. And mental health breakdown, it doesn't just go away. It can be acute, but untreated, it can become chronic. It lasts for periods of time. See a question, a mental health professional, what, if anything, can I, as a white mental health professional, do to best work with and meet the needs of Black clients? Just meet them where you are. Don't try to be what you are not. And admit, I don't know. When I have people who are of other ethnicities, whether they are Muslim or Arab or Hindu or some Asian, some Asian communities I'm familiar with, but there's some I'm not. I'm like, I don't know. Help me to understand. I want to know. Just be authentically you. There's no way I can be effective if I tried to all of a sudden come in dressed in, let's see, they're called different names in different places. But when I was in, I think Jordan, I picked up some keffiyehs, the white, I won't call it a scarf, but head covering that's very light. And you have the red, some that are red and white and some that are black and white, the cords that go around it. What I'm going to do, pull it out of my closet and come in and no, that would be very offensive. But just be authentically who you are, admit what you don't know, and go from there. And you can ask them how, I'm not African American. How can I best help you? Is there anything that I can do as a mental health professional that will be helpful in our journey together? I see a strong Black woman. Yeah. Okay. All right. Great. That's a good observation. And then it's forgetfulness part of normal aging. It can be. I've known some therapists I worked with. He retired and he was around in his 70s. And he had noticed some cognitive decline in memory. And he actually took a course on helping his memory get better. He said it worked. There were some techniques. I didn't ask him what they were, but he said that they did work and did help him. But I'm real big into neuroscience and trauma and looking at brain imaging. One of the things you can notice is that when you look at people who suffer from Alzheimer's, start looking at the brain. The brain may look like this. All of a sudden, it seems like it may be shrinking. And then there are gaps. It's like part of the brain tissue is deteriorated or gone away. And so when you start looking at brain imaging of people that have mental health issues, when the cognitive decline, you can see changes within the brain. But you have to be able to look at the imaging and have someone who's trained at recognizing what's going on to explain that to you. Okay. Actually, there's some good videos out there on YouTube, probably some other places. I love watching surgeries. Some people can't stand that, but I'll go and say, hey, hip replacement. Because my surgeon, my orthopedic surgeon told me I may be up for one. I said, okay, well, let me see what they're talking about doing. I said, oh no. I said, thank God, if I had to have that, they'd put me to sleep. Okay, Michelle, good. You can be authentic with them. That's the best you can do. Yeah, and let them know, or have them let you know what's working and not working. Excellent. the clients who are on medicine become involved in therapy as well. Yeah, the two go hand in hand. Sometimes talk therapy will work without medication, but certainly if it's a mental health issue, don't depend just upon the medication. Unless you have been in therapy and you have obtained the outcomes that you desired, you've learned the coping mechanisms, the skills, you learned mindfulness, deep breathing, you've taken up yoga or something else to help the brain body connect if you've suffered from trauma. But until you can kind of complete your talk therapy, and then I have people come in and see me once a month. They call it their mental health checkup. They'll see me once a month. Yeah. Any other questions or insights? Oh, raised hand. Yes, ma'am.
Dr. Dowdy, how do we normalize people over 40 seeing therapy as being a good thing? I can remember in my job calling parents and saying that we've done an assessment and your child needs to see somebody, and it's met with a lot of anger and resistance. How do we get people over 40 to see that it's okay?
Well, one is education in itself, because not knowing why the person is responding the way that he or she does, that the parents do, sometimes it could be because they themselves were affected by something. But let's just say it's just a response out of stigma. Try to get them educated. Or send them some resources, or send them some links or something about the importance of mental health. Or if there's someone that you know and trust who can help them understand, that would be great as well. But education is part of the key, educating to what mental health is and what it is not. Did I answer your question?
He's going to ask it himself. Another question.
Okay.
Hey, how you doing, Dr. Dowdy?
Good.
I guess the question that I have, it seemed like even when you're talking with church members, and I know you mentioned it earlier, that is the hardest group to convince. It's almost like saying that if I tell you I need glasses, you say go to the eye doctor, and the church person says if you pray about it, God will heal your eyes.
Mm-hmm.
Put people in place. But when I was being raised, if you go to therapy, you was looked at as being crazy.
Mm-hmm.
So it's how do you, even though you're given the information, I don't know, I guess I'm caught in the middle of that transition of trying to get people to see that it is a positive thing to get help and you're not crazy. But it seemed like that is like throwing an egg up against a concrete wall. It's not going anywhere but splattering.
Mm-hmm.
So my question is, how do you get people to turn the corner before they hit rock bottom?
Sometimes that can be a challenge. Sometimes, as much as you want, people just don't come around as fast as you would like for them to. But one of the things is that when you start talking about mental health, like I said, some people think you're crazy because they'll think of people who may be schizophrenic or psychotic, so from some psychosis or killer or something. But there are simple matters and simple issues. Sometimes people come in and it could be grief. Pastors do this. Pastors talk to people about death. They counsel with people about grieving and bereavement. If you're in a spiritual crisis, you talk to someone. There are many things that is typically a diagnosis for, but it's nothing on a severe level that the turnaround time may be within months, maybe 6 months, maybe 3 months. Have a much quicker turnaround time because, it doesn't carry, there's not a whole lot in the brain chemistry that has changed. And so it may be something talk therapy can help people with through quickly. But that can be a tough one. And I know that's probably not what is helpful to you, but getting people to understand that. And you can't want it worse than they want it for themselves, and I'm sure you know that. So unfortunately, that can be a tough one. Or you can send them to somebody like me, just to talk to, not to come see, but just for information. Say, hey, if they'll do it, if they'll call me and ask me those questions or concerns that they may have. All right, lead time needed for an appointment. But getting an urgent appointment, well, a couple ways you can do that. You can call around. You can go to Psychology Today, and that's a matter of phone calls, finding the therapist you want. Or you may talk to your primary care physician or wherever you go, whatever center you go, whether it's UNC, if you have a my chart, and put that in that it's urgent and that you need to see someone. And that puts the onus on that particular organization to help find someone for you that can get you in right away. And most of the time, though, depending upon what the issue is, the emergency room. Usually there's a psychiatrist who is there, who's on call, that can help you. How do you feel about virtual appointments? At first, I didn't like them. I wouldn't do them. But then something called SARS-CoV-19 came along, and that was a game changer. And now I'm just as comfortable with virtual sessions as I am in person, but I am limited to some extent because I only see people from like a certain distance, from like the chest up. I can't see body language. I can't see some of the tics. I can see it from what I can see, but like if the pat in the foot or the fingers are wiggling and moving or something, I can't see that. But other than that, about half of what I do now is virtual. Yeah. Some people like in person, they don't want to do virtual. They feel that they do better in person. And so those are the people who will only do in-person appointments. The African-American churches, when is it okay for the pastor to refer someone to a therapist and not try to have someone? That should happen all the time. If it's beyond your scope of training as clergy, if it's beyond your scope of training, refer. As a pastor, I would only see somebody 3 times and I refer them out. Why? Because as a pastor, I didn't have that kind of time to do in-depth therapy like I do in my counseling office. So my limit was 3 times. We couldn't come to a pastoral conclusion that was good, and I thought you needed some more time, I will refer you out. Yeah. But no one should be trying to operate at a scope that's beyond their ability, beyond their training. And then you start doing some detrimental harm. Yeah. And yes, nonverbal cues are important. That's why I'm not real big on the telephone. I might do 1 or 2 persons by telephone for whatever reason, but I can't see anything. Or on video, when people say, I'm not dressed, well, one time that may be okay, but we can't do every session like that because I can't see you. I don't know what's going on. I don't know what's happening with you. And I can't say in a space because, with virtually, we're not sharing the same space, but we are sharing together. I see a 729. Yes, hiding. Okay. Have I ever been fooled by someone? Yes, I have. And I didn't realize until later. Because if I thought someone was trying to fool me, and I'm not saying they haven't before, but there has been a time or two where I realized after they were no longer coming in, I think somebody just got over on me. But people will tell you what they want you to hear or what they want you to know. But someone who's going to be authentic in therapy should really be really should be open. And granted, it may take some time before some people feel comfortable enough or willing to share some deep secrets. Sometimes it may take a year or two before somebody said, oh, and this happened. And we've been seeing each other on a weekly or bi-weekly basis for over a year. Yeah. All right. I want to be respectful of the time. And the moderator, is she present?
Yes.
Okay.
If no one has any more questions, we will end our lecture for the evening. Dr. Dowdy, I want to thank you so much for all of the wonderful information that you shared, responding to everyone's questions, and just giving us a lot to think about, and hopefully encouraging those here to be able to encourage others to pursue services if they need it. Would you like to share your own practice information if folks would like to receive services? And I'm also going to be sharing some links like Psychology Today and other sites where people can look up services as well.
Sure.
Okay.
Main way is probably my website or Psychology Today. If you go to Psychology Today, you put in the therapist, you can put in my name and it will pop up. Or if you go to my website, which is simply dowdypsychotherapy.com. My last name, psychotherapy.com, and you'll come to my website, www.dowdypsychotherapy.com. And I can get your messages that way as well. There you go. That's it.
So I put that in the chat for everyone. And again, thank you, each and every one of you, for giving your time this evening to receive this wonderful information. And before we go, I do want to share that we do have 2 upcoming events. So on Friday, June 17th, at 7:00 p.m., we are going to have our first spades competition and family game night. So if you are available, please feel free to join us on Friday evening at 7. There will be food, there will be games, and it's just going to be a wonderful time. And if you are good at spades, I encourage you to join us for the event. It's going to be a lot of fun. And then that following Saturday, June the 18th, we are going to have our full day event from 10 a.m. to 2 p.m. And we have an awesome lineup. We have poets, we have a live band performing, we have a high school drum line who's going to be out, step teams and singers, performers. It's going to be a really awesome day. And feel free to bring children and grandchildren because we're going to have some inflatables and a kids corner. So I just hope that if you can make it, you will join us for both nights if you're available. And if there is nothing else, I'm going to let everyone go. And if you think of any questions, please feel free to let me know or email them. I'll put my email in the chat and I'll see if I can get them back to you.